Everything I have done in my life, educationally and professionally, has prepared me for this precise moment in time. We have a generational opportunity to fix our healthcare system and help people stay healthy for longer.
Dr. Mehmet Oz there shortly before he was sworn in as President Trump's administrator for the Centers for Medicare and Medicaid Services just over a year ago. And he is joining NewsNation Prime tonight to talk about his work in the White House so far. This interview as Dr. Oz just put the governors on all 50 states on notice over fraud. They now have just over a week to identify and remove non-compliant Medicaid providers. Not cooperating with Oz's 50-state audit could look like this. Earlier this month, an Operation Never Say Die, federal agents raiding multiple Southern California homes and offices allegedly tied to hospice fraud, arresting 21 suspects, with some accused of paying patients to pose as terminally ill. What Dr. Oz is calling his fraud war room now kicking into high gear, with one of the next steps being to block fraud before it even happens. How? Utilizing artificial intelligence, he says. All this because Oz believes the federal government is too trusting of certain providers, and he estimates there's around $100 billion stolen every year from these social services our tax dollars pay into. We asked Dr. Oz more about that and more, including President Trump's recent executive order to ease restrictions and speed up reviews of certain psychedelic drugs for medical purposes. Does that mean we will see approval for magic mushrooms and LSD coming up soon? Here's my conversation with Dr. Oz. Dr. Oz, great to have you with us. Let's jump right in and start with a headline a lot of people are tracking right now. President Trump's executive order to speed up research into psychedelic drugs. It specifically mentions ibogaine. Dr. Oz, in your eyes, who benefits the most from this, and what do you believe is the biggest risk?
There's lots of tantalizing evidence that altering the way people view the world around them can benefit folks with post-traumatic stress disorder, refractory depression, a whole slew of conditions. And ibogaine is a drug that has very low addiction potential because apparently it's such a miserable experience you would never do it for fun. But it does tend to reset people in ways that may benefit them. It also may have some neuroregenerative benefits, which means it might help brain cells recover. So if you had traumatic brain injury, which is often associated with the post-traumatic stress disorder, depressions, anxiety, some of the things that folks can be afflicted by, and maybe even with substance use disorder as a coping mechanism, it could be helpful. Veterans have been swearing by it. Lots of Americans have been going overseas to get this program. Joe Rogan has talked about this both on a show, but also with the president. And as the president began to realize that not just ibogaine, but other psychedelics like MDMA, psilocybin, magic mushroom, these are drugs that have been around for a long time, but they do have, in that case, they've been used as a street drug, but they might have therapeutic benefits when used appropriately by skilled practitioners. And that's why the president insisted on this executive order, which was executed last Saturday. And we've gotten a remarkable amount of positive feedback because these conditions are really difficult to manage, and the success of traditional pharmaceutical drugs is limited.
Dr. Oz, with the time we have, I want to switch gears and talk about what's next for the MAHA movement as well. The list of accomplishments already stacking up. It is admirable. RFK Jr. saying he wants to clean up the food supply, starting with removing hazardous synthetic food dyes, tougher scrutiny on food additives as well. And just this week, we see lowering prescription drug prices, a big deal with Regeneron, the 17th pharmaceutical company to lower drug costs there. Now, we know not all Trump supporters are satisfied. The group calling themselves the MAHA Moms, they've been really vocal in their disappointment in things like increasing the production of glyphosate, that weed killer linked with cancer, rolling back the limits on forever chemicals in our drinking water. Dr. Oz, do these MAHA moms have a point? Should there be no compromise when it comes to the health of Americans?
Well, the president is pushing for the health of Americans. The unfortunate reality with glyphosate, which is Roundup, is that American agriculture is addicted to it, and you need to give the farmers time to be able to move off that product into other ways of growing their crops with the same efficiency. And this should have been done years and years ago. I remember talking about these kinds of problems on my show at least a decade ago. And the president finally just wrestled this down and said, for now, we got to deal with this issue that's in front of us, which is making sure that food is affordable in America and that our farmers are protected. But we're going to quickly, I think, over time, you'll see as science now starts to focus on this problem, address it. But the broader narrative about MAHA is about making it easier to be healthy. And if you look at what the administration has accomplished, it's remarkable. You mentioned some of the issues around things like food dyes. You know, obviously, if the food you're about to put in your mouth has stuff that other countries don't let manufacturers use, that's a concerning issue. But we're also focused on plastics. We're looking at things just in my area of specialty, which is CMS, Medicare, Medicaid, of making healthcare expenses more affordable, making sure that you have access to medications at an affordable price so that if you do have a chronic problem like diabetes, you can take the medication that can treat your diabetes so you don't develop chronic illnesses from it. And you touched on it briefly, but just to underline this, pharmaceutical prices in America are so high that 1 in 3 Americans leaves the pharmacy, you see right there in that image, without the drugs they went there to pick up, despite the fact their doctor told them to take that medication. So the president said, enough's enough. We know we pay 3 times more on average than a European pays for the exact same product, made often in an American facility. So he's insisting that we have most favored nation pricing, which means very simply, whatever you charge overseas, you charge to Americans. Our drug prices, therefore, some of these really important ones like the weight loss drugs, the GLP-1 drugs, they now plummeted in price. Americans can afford them. And the good news is, as we get them more readily priced, it actually ends up saving our country money because by making Americans healthier, by reducing, in the case of these GLP-1 drugs, the amount of obesity we have in America, we have less diabetes, less hypertension, and all the complications that would have normally arisen no longer happen. We save money.
Yeah, so there's a lot there. I want to return quickly to Roundup and glyphosate. Do you think increasing the production of glyphosate is really about protecting the farmers, or is it evidence of how powerful lobbying is and how powerful companies like Monsanto actually are?
It's very much about protecting the food supply in America and giving the system time to adjust. I think you'll be impressed at how many really smart people are just focused in on some of the ways that Roundup are used, some of the different alternatives to that product, ways that farmers could grow crops in a similarly efficient way without being dependent on, again, a compound that probably should have been addressed a long time ago. But the president's got to deal with the issues that are in front of him. He marches with the army he has. And I am happy to say that the Maha community is strongly supportive of him. As someone who's been supportive of that community for a long time, I feel confident in that statement.
Let's talk about fraud. It seems like there is more uncovered every single week. I know that you're launching the Fraud War Room, using AI and real-time data to try to block fraud before it happens. It almost sounds a little like the Minority Report. Tell me about, how you want to use AI to fight fraud, and how does one make sure that AI doesn't wrongfully freeze a legitimate doctor, hospice, or patient?
Well, part of the goal here is to copy what's happened in the financial sector. Think about this. Bank managers are not really good at fraud. They wouldn't be bank managers if they were, but fraudsters, they're really good at fraud. So we realize is that and this is often really well-trained foreign entities are involved in some of this fraud. These are not mom-and-pop fraudsters. The corruption in the system is as bad as it is because you've got organized crime involved as well. And so to use an all-of-government approach, which includes, by the way, using all the tools at our fingertips like AI could be helpful. It worked in finance because the banks could now use AI to detect what fraudsters would do that a regular bank manager would never think they would do. We're using it to do the same. We have wonderful human beings that work at my agency, CMS. There are about 7,000 of us, but none of us, I don't think, went into this job to be fraudsters. Now AI is helping us detect subtle ways, games that, for example, we believe the Chinese mafia is using in New York State in order to take advantage of adult daycare centers. We know that's being used by the Russian mafia in Los Angeles, where they have 1/3 of all the hospices in the whole country. And now these big data programs can point to us exactly which of these hospices, which again, they're designed for the last few months of your life. What if everyone survives in the hospice? That's a red flag. What if doctors are the same ones in every one of these hospices pretending everyone's about to die? It's a red flag. So we begin to put those red flags together, and using some of these larger data systems can be able to identify fraud and then go after these guys with a lot of evidence.
So also this week, you're announcing this 50-state audit of Medicaid program oversight across the country. Reports say that you want answers from governors within 10 days. What happens next if fraud is found? Are we talking about criminal charges? Are we talking about raids?
Everything's possible. We saw a big opportunity in Los Angeles where, as I pointed out, hospice has become such a problem with just an infrastructure that's corrupted and rotten that you couldn't tell which hospices you could trust. And remember, if these people will steal your money when you're in a vulnerable situation, they will definitely steal your health and your life. So we busted into plush neighborhoods, beautiful houses that you'd love to live in, and you can see this footage reflects some of these cases. But these individuals bought these facilities with ill-gotten gains. And so, yes, marching them out and stopping their businesses in an aggressive way, I think makes a lot of sense. But we also have ways that are more subtle but also effective. Like, we have stopped paying more than 400 hospices in California based on the evidence that I mentioned earlier, and we're not hearing complaints. Right? So we seem to be getting our targets appropriately identified, and when we take action of that nature, the money never leaves the building, and that's the big story here. If you can, never let the money leave the building. That way you don't have to go figure out where it went later on.
We have to talk about rising healthcare costs as well. We know Affordable Care Act premiums or costs, they're up 60% in the past decade. And we crunch the numbers here. Americans are paying $611 today for Obamacare Silver coverage that cost $381 in 2016. It's an extra $230 per month. So, Dr. Oz, who is most to blame for these skyrocketing costs? Is it insurance companies? Is it big pharma? Is it the doctors? Is it politicians? Because Americans are telling us they can't afford it. And if you could do one thing to fix these skyrocketing costs, what would you do?
Well, in the case of the ACA, it's a team effort. Every one of the people you mentioned plays a role in it. But fundamentally, in the ACA, the Obamacare, there was a willingness to just pay whatever was being asked. And so when you throw money at a problem, people running the system will take your money and they'll make sure that the charges match what you just paid them. And we saw that happening in many different situations. We still believe there's a lot of fraud in the ACA. I mean, millions and millions of people are not supposed to be on the Affordable Care Act, Obamacare exchanges, but they're either put there by mistake or they don't know they're there, or fraudsters. And we're talking about people making hundreds of millions of dollars off the system, dishonestly pretend that you're eligible for Obamacare when you're not. That's why
I hear the fraud piece of it. If you could do one thing, no pushback, to fix this, what would you do?
I would ask everyone on Obamacare to pay $5. Why? Because if you pay $5, I know you're real. You're not a fiction, made-up person. You're not someone whose number was stolen and illegally placed on the program. You actually want to be on the program. You're not already on Medicaid or living in a different state. And when we look at these numbers, these are tens of billions of dollars being lost because we don't even know that you're supposed to be on the program. The people who need to be on the Obamacare system should be on it. Folks who've left it for good reason or other, they should be not being paid for by the American taxpayer.
Dr. Oz, appreciate your time today. Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.